They don't work together. Is there additional ways to get help? Yes, there is. So there's Medicaid, also works with Medicare, and that's for the low income. Medicaid is a state-run system. Medicare is a federal system. Medicaid can help cover costs for low-income folks. You have to qualify with income and asset levels and apply directly through your state. Medicare savings programs are a lot more like Medicaid. In the state of Virginia, we don't have much for Medicare savings programs. Extra Help or Low Income Subsidy, LIS, is a program that's run through Social Security. And that one helps only with prescription drug coverage, but it helps to lower not only the cost of a prescription when you go to pick it up at the pharmacy, it helps to lower the cost of the monthly premiums. So this can be a very valuable tool for someone who might not qualify for Medicaid, but still has lower income and assets. There are income and asset limits on this Extra Help or Low Income Subsidy. They're not quite as low as Medicaid. So Medicaid runs through the state, Extra Help runs through Social Security. Folks who have Medicaid often are also eligible for this program too. Some folks have two of these, Medicaid and Extra Help. Sometimes they're only eligible for Extra Help. Now let's talk about enrolling. When do you do that? So you can enroll 3 months if you're turning 65, 3 months before your birth month, the month of, and 3 months after. That's 7-month window that you have to enroll. Then each and every year, we have an annual enrollment period that runs from October 15 to December 7th. That's the time to make changes, especially as it applies to prescription drug coverage. So if you want to make a change in your prescription, you would apply at that time. It starts January the 1st. Sorry about that. I don't know exactly why that kicked off. Outside of the annual enrollment time frame, you have to have a special qualifying event to make changes, or a special enrollment period, SEP. And those things could include your turning 65, if you just moved or moved back into the US, or you moved in or out of a long-term care facility. Supplements. This is an interesting piece here because Medicare supplements don't run on the same enrollment period as this annual enrollment period. If you had a Medicare supplement and you wanted to change it, you can do that at any time during the year. Special just being released from incarceration, or if you lost your employer coverage. So now there are some additional resources here that you can go to. Sorry, skipped on through that a little quickly. Medicare.gov, where they actually have a drug calculator there you can use and search for plans and so forth through Medicare.gov. To apply for Medicare, you actually start at the Social Security website and apply directly there. If you already have a plan or a account with Social Security, then you would, there we go. With Social Security, you go directly to socialsecurity.gov, click on there, into your account, and there's a place there that will actually allow you to apply for Medicare Parts A and or B, as well as your Social Security benefit check, if you wanted to get that. And of course, I'd be remiss if I didn't tell you that I can also help you with some of those things. It's important if you work with someone, if you find someone you trust, that's great, do that. Because they are your advocate. If you have an agent, they're your advocate for you. They know a little bit more about what's happening with the insurance companies. They can be an advocate to go back and forth if you have any claims issues or enrollment issues and things of that nature. It doesn't cost you anything to have an agent, And so it's someone extra that kind of helps you out, and it doesn't cost you a dime. So again, my information, and I work with not only folks in Medicare, but I work with individuals on and off the exchanges, as well as companies for employee benefits, and do a whole host of personal benefits. So Steve, do we have any questions?
Let's see. All right. No questions as of yet, but while we're waiting for it, there's two ways to ask questions. Just type them in to Q&A or raise your hands. It was a very thorough presentation. And what do you see is in the conversations that you're having with people, like what are the big, concerns that are out there on people's minds that you're talking to?
So especially now with, good question, especially now with COVID, people are very concerned about copays and out of pocket if they go in and have a big event with the COVID. Of course, most of those things and most insurance companies are not charging copays or any co-insurance to the beneficiaries specifically for COVID-related care or services. So generally, they wouldn't pay anything. Of course, people are concerned about going into the doctor's office, especially those over 65, because you're already in a higher risk category. Many of the carriers also have telehealth visits now, so they're doing virtual visits, trying to help keep people stay at home, keeping them as safe as they can. If you do have to go in, it's always a good idea to call first, find out what the restrictions are. What do you have to do before you go in? Maybe you need to make sure that you have a mask, you have your gloves or hand sanitizer, and they'll take your temperature and ask you some questions. So just be patient and, kind of go with the flow if you can, if you have to go in for a test or a procedure. The hospitals, the doctors, the providers, they're doing as much as they can to make sure that things are sanitary. They're trying to keep people safe and keeping things as clean as possible. Of course, now people are also concerned about, those final life expenses. Do I have my affairs in order? And is my family covered? And those kinds of things. So there's been a lot more questions about those issues too, because they may have been touched by someone who actually perished from the disease, or they know someone, they've been touched by it in some fashion.
Okay, great. And then We Hang says, are there any programs that assist folks transitioning from MA, which I assume is Medicare Advantage, to Medicare?
To original Medicare? So that if you're going back to original Medicare, then you would have those out-of-pocket costs that we talked about earlier, and you could get those costs covered with either a Medicare supplement and a prescription plan, or if they'd be eligible for Medicaid, that's also another way that they could get some of those out-of-pocket costs covered. I forgot to mention too, Steve, that I did send you an attachment for a workbook that has a lot of the same information in it that we discussed this evening, or that I discussed this evening. And he will email that out so that you have that also as reference information.
Yeah, definitely. We can send that out this evening or first thing in the morning to all the folks that registered. We Hang says, thank you. Very informative presentation on such a complex topic. So let's see. I don't see, you were very thorough. I think if you were less thorough, then we would have more questions. But the fact that you're following up and you've done this so many times, Lisa, I know why your presentation is so thorough, because you know the questions before they even ask them, and you bring them into your presentation. here. We'll get Allegra back for some closing remarks.
Lisa, I do have a question. Now, you said that people with disabilities, now they are also eligible for Medicare. Is that correct? Is there an age, or how does that work?
So there's no age attached to that. They have to be on Social Security disability for 24 months, and then they're automatically enrolled in Medicare. So that's another way that they can get in. Or if you've been diagnosed with some specific illness like end-stage renal disease, Lou Gehrig's disease, some of those things make you eligible right away for Medicare.
Okay, gotcha. So there's no age on that. It just comes with the disability.
Yes.
Okay, gotcha.
Right.
Perfect. Thank you. And I agree. It was very thorough. So, which is why I'm sure. I mean, if any questions do come up, we do have your information. Can the audience email you too, Lisa? You said.
Absolutely. I'm always happy to answer questions. I'd much rather people have the correct information, and if I can help them through that, then that's most important.
Perfect. Well, I think then we're going to wrap things up. So Lisa, thank you so much. And Steve, thank you for all the IT and bringing us the platform of Zoom. And if we have anything else, we'll definitely email you, and we'll send out the resources in the morning or later this evening. So if you guys have anything else.
Yeah, and what I'll do, Allegra, I'm gonna email you the recording of this. So do you have a YouTube page or?
Yeah, so this will live on our Facebook, and then we'll put it up on a YouTube too, and so we can share it. Thank you so much for watching Medicare 101 with Lisa Humes. Again, thank you, Steve Gurney and the Pro Aging Network for hosting us. And we hope that you'll become ambassadors for older adults in your life. Check us out on Facebook, Instagram, Twitter, and YouTube. Take care.